iSARMs.com, the #1 place to learn about SARMs online.
Welcome everyone. Dylan Gemelli here today with a brand new video for you, and today's video I want to talk about a topic that I've been asked about quite a bit, and I have just not gotten around to making a video for it, so there's never a better time than the present. I want to talk to you in depth on Letrozole. So basically most of you know that Letrozole is short-term Letro, and it is the king of aromatase inhibitors. It is the most powerful means at fighting against gynecomastia that you can find. There is nothing stronger in terms of aromatase inhibitors. In fact, it's so strong that the Indian government actually banned it because of the risks that are associated with its use by pregnant women. It's really widespread in all of bodybuilding and anabolic users, and it's one of the most commonly used forms of treatment against gynecomastia and female breast tissue that is created in males. It was actually approved in 1997 under the brand name Femara. Well, it was originally approved as the main purpose to combat breast cancer in postmenopausal women. Now, obviously, we know that that's taken form and shaped in the bodybuilding community. So it's basically been applied to cancer patients, like I said, but it's actually used in the medical community to stimulate ovaries. And it's one of the compounds that's actually used to actually terminate a pregnancy. So that's a little bit of the background on it. Now, in terms of how it works for men, it's actually a type 2 aromatase inhibitor. And really, basically, it works by binding to the aromatase enzyme, and it prevents estrogen from being released. So due to its power compared to other aromatase inhibitors, bodybuilders are usually using it as a very, very aggressive means to fight estrogen quickly during certain situations where other more conservative means have failed. So, situations where gynecomastia is flaring up, for example, and nothing else is working. So if you're having estrogen-related problems during a steroid cycle and Letrozole does not work for you, then in all honesty, nothing is going to work for you. That is basically as strong as it gets. If it's not going to work for you, then this is probably something that you don't want to continue moving forward with, because nothing else is going to work for you. How exactly do you use Letro? So when certain anabolics are used, obviously we know that some of them can convert to estrogen, which is sometimes what we call a wetter compound, or just basically something that can convert to estrogen. This will cause an estrogen-related side effect such as like bloating, heart strain, gynecomastia, and many other issues. Now, an aggressive approach to treating gynecomastia would be to stack Letrozole as an ancillary compound during a wet cycle. So furthermore, Letro can be used to treat gyno since it will drop estrogen so potently. So it's going to give the person an opportunity to deal with a gyno issue that maybe they would think would require surgery. So this is one of those things that is an alternative method that has shown to actually cure gynecomastia. It just depends on how long, what caused it. When we're talking about, puberty gyno, that's something you were maybe born with, this is something that's worth a try. It's definitely worked for some. But when it comes to like just developmental or something that you're just developing, this will absolutely crush estrogen. So, but you don't want to overuse this either, because then it comes along with certain amounts of side effects. Now, in spite of the fact that estrogen is mainly considered as a female hormone, men still need estrogen in order to function properly. So absolutely annihilating it and killing it is not what you want to do either. So excessively low, estrogen levels can also cause some problems, and it can make it a lot more difficult to gain any sort of size, muscle, and strength. You're going to experience a low libido, joint problems, and sometimes I've seen even it cause depression. So it's so strong that many users often do complain about this side effect, and because their estrogen is actually crushed or depleted too much. So there's a fine line on how much you're using, and you definitely don't want to overuse Letro in any way, shape, or form. It needs to be ran properly and it needs to be ran in terms of you need to recognize how it's working for your body. If you don't need as much and you're recognizing it working fast, then scale back. You never want to go too high, too far, too long with it. How is gyno really caused? Well, it's caused by an increase in estrogen and sometimes even prolactin. So it can actually cause like sore breasts for men, itchy nipples, and it can even lead to lactation. So if it's left untreated, gynecomastia become a serious problem, and it's probably going to require surgery. And that's really not something that you want to do. A smart option would be to attempt an anti-gynecomastia protocol before having to resort to going under the knife. That would include Nolvadex and Letrozole for several weeks. Now, how exactly do you dose Letrozole? So a good starting dosage for Letro is 0.25 to 1 milligrams taken every other day. The precise dosage, as I said, is really dependent on the user. It's smart to be aggressive, but it's not smart to be overly aggressive. And you want to be able to kind of judge how your body's reacting to it and don't go overboard. Regular blood work, testing for your estrogen levels. You need to stay on top of this because there's a fine line you don't want to cross on too high or too low. So it's just something that you need to keep in mind, keep a close eye on, and pay very close attention to throughout its use. You need to stay close on the monitoring of it because it can be very problematic if not used properly. Dylan Gemelli, signing off.